We would like to start today's webinar. A warm welcome to everybody. I hope everybody is healthy at this time. Away from COVID, we like to talk about other very important topics, and a warm welcome to Dr. Geidel. He will present today actual numbers on patients underwent Ticagrelor therapy, and he will talk about the benefit using CytoSorb in emergency cardiac surgery patients. After this 20 minutes presentation from Dr. Geidel, we will have the possibility to answer your questions in case you have one. But Dr. Geidel said after his presentation, normally nobody has any questions. We will see. And also today we will talk about the health economic data. And Daniel Allen Blanco, our healthcare manager, will talk about the numbers. And we decided that we will have the answers and questions after every presentation. A short introduction. You see on your screen on the frame down, you can raise your hands. I think the symbol is self-explaining, and you can answer also. You can ask also questions. You can use the chat, and you can ask the Q&A button for this. And with this little introduction, I will stop sharing my screen, and I would like to hand over to Dr. Geidel. Thank you very much for giving us the opportunity for our webinar today. And it's your stage now.
Ladies and gentlemen, good evening, everybody, and a very warm welcome. I'm Stefan Geidel, I'm cardiac surgeon in Hamburg. And at first, I want to thank the nice people of this CytoSorb group for the organization of this webinar and the kind invitation to talk this evening. I really hope you are all doing well. This is definitely a unique period in our lives as the coronavirus has affected so many people. But regarding this, I think we can all feel united in a special way this evening because our life must go on. We have to look forward and face our duties in the treatment of patients with severe cardiac diseases, especially in emergency situations. So I therefore invite you to follow my presentation on Ticagrelor removal by CytoSorb in patients with acute coronary syndrome. This St. George Hospital, it is one of the oldest hospital institutions in Europe with a history going back to the 12th century. We are located directly at the water in the center of the city, and we're getting a lot of emergency cases from that whole metropolitan region that comprises approximately 5 million people. 2 years ago, our group has published a research on bleeding complications after use of novel oral anticoagulants in patients undergoing cardiac surgery. And from that research, we concluded first that a lengthy NOAC withdrawal period, particularly in patients with reduced renal function, is essential for safe open heart surgery. We also concluded that despite official recommendations, patients should, whenever possible, not be considered for elective cardiac operations within 10 days of NOAC withdrawal. During that research, we discussed that it would really be helpful to have a method or a tool to filtrate or extract drugs that cause bleeding complications during open heart surgery from the human blood during the operation. I want to show you that with the CytoSorb, we have such a method. Since the time of the first stent implantation in the 80s, stent thrombosis has been a significant, relevant problem of PCI patients. And so it does not surprise that the evolution of PCI, and here you can see the data of Germany, that the number of the PCI procedures are still going up while the data of CABG are going down, even if our results are so good. It does not surprise that the evolution of PCI has also been an evolution of antiplatelet therapy after PCI. And the study that catapulted Ticagrelor in our minds, in our clinical practice, was the Plato trial 11 years ago. And this study showed us how really good Ticagrelor is in the primary endpoints of cardiovascular death, myocardial infarction, stroke, and stent thrombosis. And even if some months ago, this study has been published that showed that prasugrel seems to be a little better in preventing from ischemic events. Ticagrelor is really very frequently given. Now, how does it work? It is a P2Y12 receptor antagonist that has a direct acting. It does not require any metabolic activation. It has a rapid onset of its effects, and it shows something very useful, protein binding. We'll come to this later on. And I think you all know that the 2017 ESC guidelines for STEMI patient recommend to give such a potent P2Y12 receptor antagonist at latest at the time of PCI. So what happens when a patient has to go to the OR after this or in the end? We have a high incidence of major bleeding complication. You see in that figure that it is approximately 40% at the first day and still 25 or more than 25% at day 2 and day 3, and then day 4, it's below 10%. So it is a strategy to wait, like these authors recommend. When the patient is stable enough, it's better to wait for to prevent from severe bleeding. But what shall we do when a patient is really not stable and has to be operated as an emergency case? In May 2017, this experimental research has been published that demonstrated that the CytoSorb adsorber is able to remove Ticagrelor from the human blood with really high efficiency of almost 100% using the protein binding to albumin. Now, what's CytoSorb? It uses a high-tech polymer technology. It's a small box of a height of approximately 20 centimeters, full of small bullets with a really high surface. It was initially constructed to remove cytokines in septical situations, but it has been shown that it is able to remove other hydrophobic medium-sized molecules from the blood. And we read that paper a short time after it had been published and were confronted with an emergency case in June 2017. And I still remember this as if it has been yesterday, because I operated on that patient in that Friday evening. It was a young man with a type A aortic dissection, and he was loaded with Ticagrelor after PCI of the circumflex artery. And we had still time to talk to him and said, man, this is really an emergency situation and a high-risk procedure, and it's even more risky because you have taken that drug. But we have an idea. There is something like a filter. It's not a filter, it's an adsorber. But anyway, we would like to put it into the heart-lung machine. And one of our perfusionists made a drawing how we would put that CytoSorb adsorber between the venous reservoir and the oxygenator, and the patient agreed. And the result in that individual case was so good that we decided from that weekend that this should be our standard procedure in patients loaded with Ticagrelor. And this is a picture from the paper we wrote for the Annals of Thoracic Surgery. And if you will show us the honor, I will be happy. You will find in that paper that we investigated on 43 Ticagrelor patients and also 12 rivaroxaban patients. This is a figure from another publication, a local publication we wrote for our local doctor's journal, but the interest in this was so high in Hamburg. So I wrote this article on how to reduce bleeding complications during open heart operations. Now, when we look at that 43 cases, you see that 32 of them had been done with a CytoSorb adsorption, and we had a small control group of 11 patients done without from June 2016 until that June 2017. And when you will look at our paper, you find this table, and here you see these groups. All had been true emergency operations, and all patients had an underlying coronary artery disease. Some of them were combination procedures. Anyway, most of them isolated CABG procedures. And I want to show you that result of this paper at one look. This is a graphical abstract we were asked to write for the online version of this paper. And here you can see in green on the right side, you see the patients done with adsorption, and on the left side you see patients done without. And here you see the p-values. We were able to improve almost everything in the respect of a good patient blood management. Less transfusions, better retrocotomy rate, shorter operation time, better drainage volume, shorter ICU stay, and shorter hospital stay. But as I told you, some of these patients had been treated with rivaroxaban, and this evening we're talking about Ticagrelor. So we have done an update of our data until June 2019, isolated CABG procedures. So we have now a number of 55 done with the adsorber method. And we published this at the annual meeting of the DGTAG in Wiesbaden some weeks ago. As you can see here, we were able to reduce the operation time with the adsorption method for 80 minutes. And I want to add that we normally use, even in the emergency cases, both thoracic arteries for complete arterial revascularization. Further, we were able with the adsorber to improve or to use less transfusion of platelets. That was a significant difference. So 65.5% did not need any platelet transfusion. And in 80% of cases, we did not need any red blood cell transfusion. When you look at this figure showing you the drainage volume, you see significantly more bleeding in the drainage over 24 hours in patients without adsorber compared to patients with adsorption. And the retrocotomy rate was only 1.8%. And when you remember, these all were emergency CABG cases loaded with Ticagrelor, complete arterial revascularization, then a retrocotomy rate of less than 2% is really very low. Now, these are clinical data. And now there is a question, is there a blood test to validate effectiveness of this method? There is the multiplate analyzer that offers the possibility of rapid determination of platelet function. This is this little machine, and it's a simple method. It's an ADP test, and it works like this. Upon activation, the platelets aggregate on metal sensors and increase electrical resistance. So when you have activated platelets, you have an increase of the multiplate values. We will have that multiplate analyzer in the future. During that research, we had to give our blood or the blood of the patient to another institution. So I can give you only really a handful of lab data, but I think they are interesting enough to show and maybe to discuss it later. Here you see something very familiar, the platelet counts of 5 patients before and after CPB, and you see that the platelet numbers go down. And when you look at patient number 4, you see that that guy crossed the border of 100,000, and this was the only patient who did not show a nice increase like the others in the multiplate level. He showed a decrease, and this was the only patient who had a relevant bleeding after surgery. And the truth is, we don't know why. The patient was old, okay, he had low platelet numbers, okay, but maybe the albumin was loaded with other drugs or the adsorption came up against limiting factors. We don't know. This is only one of the open questions. The other is the duration of adsorption time to fully eliminate the drug from the body is unclear. Which blood test could eventually validate the effectiveness of adsorption? We talked about the multiplate analyzer. Direct measurement of Ticagrelor metabolites is only available in highly specialized centers. What about the effectiveness in NOAC patients? I told you that we investigated some patients with rivaroxaban. When you look at that drainage volume figure, I have already shown you Ticagrelor here with adsorption and without. You see the almost identical figure for rivaroxaban patients. So it does also work in NOAC patients. This has been already shown in experimental research. And we saw that, or could describe that clinical effect. Now, we were interested in economical effects, and just in a very short way, I want to show you what we investigated. We focused on that 66 isolated CABG patients and wanted to know whether there is a benefit of CytoSorb, and we did a cost calculation. As you can see it here, we calculated the price of a retrocotomy and transfusions and so on, and then did a bootstrap analysis, what is a resampling. And this resampling showed that with the CytoSorb, we saved more than 3,000 euro per patient. And the adsorber costs were already taken into account. And the operation duration time and the ICU stay, as you can see it here, had the highest impact on the level of cost savings. So in conclusion, we could describe both medical and economic benefits of using adsorption in Ticagrelor-loaded patients by reduced operation time, faster discharge from the ICU and the hospital, and a generally improved patient blood management. So we think that the adsorption method with the CytoSorb is a really safe and effective method to reduce bleeding complications and to improve surgical outcome significantly. Maybe you know this, the CytoSorb has a CE mark for this since a few weeks. Of course, there are limitations. I presented non-randomized study data of a single center. The control group was small, so definitely more prospective investigations are needed to confirm this preliminary data. And this is exactly what we want to do, a prospective multi-center trial, including determination of platelet function with a multiplate analyzer and a direct measurement of Ticagrelor and its metabolites. We have already given the protocol to our local ethics committee, and hopefully our group will be able in a short time to give you more interesting data on this topic. For now, for today, the adsorber method has become our standard procedure in patients loaded with Ticagrelor and also with rivaroxaban. In the end, I want to show you one more case. I think you can see at one look what had happened. It was a young woman with single vessel disease of the right coronary artery, and you see that's a big vessel. And that case was a really nightmare for the cardiologist, a really skilled and nice doctor. But what happened during PCI, patient Ticagrelor loaded, there was an occlusion of the vessel and a dissection of the ascending aorta. Operated on that patient last year, but I felt so much more comfortable and confident in that case because I know that the retrocotomy rate is so low and we don't have to give blood cell transfusions or platelets in the majority of patients. So I can only recommend to make your own experience. I think you will really like this method. So thanks for your attention. Please take care, stay healthy, and hopefully we can see each other in the near future face to face on the next meeting, the next Congress. Thank you so much.
Thank you very much. There is one question from Vishal Garg. He asked for, do you use cell saver in all cases?
Cell saver, that's a good point. We use cell savers at the beginning, but sometimes when during the preparation of the thoracic arteries, we see, oh, this is really would be helpful, we take it, but not as a routine in every coronary case loaded with Ticagrelor. Normally, we avoid to use it in most of the cases.
Okay, thank you. There is another question from Dr. Hassan. And no, this is Emmanuel, senior perfusionist from India. He has two questions. The first one is heparin absorption by CytoSorb during cardio-pulmonary bypass. You found out something in this case?
I don't know. No, there's no heparin absorption with the adsorber. It doesn't interfere with the heparin doses at the heart-lung machine.
Okay. And the second question is from him, any other drug absorption you may realize by CytoSorb, like anesthetics, drugs, inotropes?
Antibiotics, that might be, but this is under research. The absorption does not only focus at Ticagrelor, there might be absorption of other things, but we haven't seen any negative side effects by absorption.
Okay. And I think there is also an antibiotic statement from cytosorbents. So, Emmanuel, if you have a question, I think Biocon, as your partner in India, can help you providing the statement. There's another question, and it's from Zaravan Perumal, perfusionist also from India. So hello to India today. What about CytoSorb in emergency ECPR? You have any experience with that?
No.
Okay.
Sorry.
No problem. Okay, let me check the other. Okay, there is a last question, I guess. We can answer. It's like, how effective is CytoSorb absorption in clopidogrel? I'm sorry.
I think it doesn't work in clopidogrel. It doesn't work in prasugrel. It works in Ticagrelor because there's a reversible block of that.
I mean, the big benefit is that the Ticagrelor, the use of Ticagrelor is that the platelets are not destroyed by Ticagrelor, just connected, and by removing the substance, the platelet can work.
Yeah. Again, it's also effective in some NOAC. It has been shown for rivaroxaban and dabigatran also.
Yeah. And do you have any experience with using CytoSorb in patient on bleeding, patient bleeding post-operatively?
What do you mean at the ICU or?
I think so. It's a question also from Vishal Garg.
No.
Would you use another CytoSorb if patient was bleeding in post-op?
No,
I think
we only used one CytoSorb. I must think if we have done it in ECMO patients, but no, cannot remember.
I mean, the big benefit from this procedure is that you can see it on the table, right? After disconnection, the heart-lung machine, you can see that the benefit of using CytoSorb. So in best case, what you said, it's your standard procedure. There is no bleeding afterwards anymore.
Yeah.
Okay. Super. Thank you very much. Then I think we answered the question. Let me check. There is a chat function as well. For Mohammed, to all panelists, yes. Can we use it more than one time? No. CytoSorb is a single-use product. So after using cytosorbents in the heart-lung machine, it's done with that. Off-pump surgery, Dr. Geidel, I don't know if you have an experience with off-pump surgery, but I think without the heart-lung machine, there is no connector. Right? So, okay, then I would stop sharing my screen again, and I would hand over to Daniel Adam Blanco to provide you some health economic data from this topic.
So I'm going to discuss the budget impact analysis of CytoSorb therapy in emergency open heart surgery patients receiving Ticagrelor. I'll revisit again the clinical evidence very shortly, very briefly, to understand why it matters from an economic perspective. And then I will discuss the health economic analysis that we have performed. And finally, if you have any questions, we can go through those. We used the clinical evidence presented in the original publication. As you can see, there was evidence of a reduction in the percentage of patients requiring reinterventions in the CytoSorb group, a reduction in the length of surgery time, in the need of transfusions for both red blood cells and platelets, and in the length of stay, particularly for ICU. And we will go through all these parameters and explain why it matters in terms of an economic perspective, okay? So the length of stay matters because, of course, ICU is a bottleneck for treating patients, and hospital stay, whether it's ICU or the general ward, is an expensive resource. And you have some examples here for Germany, costs for Germany, which are very similar to the costs already presented by Professor Geidel. And for Poland as an example, but of course this, so that you can, these resource costs are very similar over Europe. And it's not only an expensive resource, but it has an impact on the patient's quality of life. There is ample evidence that a prolonged length of stay in the ICU has an impact in the quality of life of the patients in the long term, not only in the hospital, but also in the long term. Blood products are scarce and have an influence in the timing of surgery. They're also expensive resources in themselves. As you can see here, the prices for Germany are very stable all over Europe. You can find very similar prices for these products in Spain, in Italy, France. But also transfusions have been linked to long-term complications. And I don't have it referenced here for the sake of time, but transfusions in cardiac surgeon patients have been linked to a decrease in the survival rate over even 7 years after surgery. And then there is surgery time. Reinterventions have an impact in patients' quality of life. That's obvious. Plus, reinterventions are not always covered in the funding that the hospital is managing. This is particularly the case for Germany, but we know this is true in other countries. So if you need to do a reintervention within 30 days of the first intervention, they are not always covered by the funding provided to the hospital. But also the operating room is expensive and another bottleneck to treat more patients. Just as an example, this is a very conservative estimates of the cost of rethoracotomy. We have found much higher values, but we use very conservative estimates. And the cost of surgery, the minute in Germany and in Poland. For example, in Spain, we found a similar cost of 1 minute of surgery, and it was not taking into account the cost of the surgeon itself. So as you can see, these are parameters that are very expensive, very valuable. So the research question is CytoSorb plus usual care versus usual care alone in emergency open heart surgery patients receiving Ticagrelor cost saving? And in order to answer this question, we performed the budget impact analysis. A budget impact analysis is a cost analysis from a hospital perspective. There are different types of health economic tools. The cost effectiveness analysis are usually done from the healthcare service perspective, taking into account life years gained and quality of life. The budget impact analysis is a simpler option. It only takes into account the hospital perspective, and it's expressed merely in terms of cost outcomes, but also clinical endpoints like length of stay and so on. So the methods were, as I already mentioned, the short-term economic impact of CytoSorb therapy. By short-term, we mean about 30 days. Hospital costs were informed by peer-reviewed literature and official sources, and then were confirmed by experts. So why we confirmed by experts what is official sources and peer-reviewed literature is to confirm that they are up to date. The cost of the CytoSorb therapy is of course included. And then we run a series of statistical analysis in order to factor in the uncertainty regarding the parameters. So, and then we can estimate the impact of each variable has in the result. That's why we run probabilistic multivariable analysis or one-way sensitivity analysis. Of course, we have to take into account the limitations of this type of economic studies. They are always limited by what the original data can offer. The design of the study in itself and the number of patients and so on. This has to be taken into account, that this is the limitation that we are working with. But it can be somewhat compensated with the probabilistic analysis that we discussed earlier in order to assess the magnitude of the uncertainty surrounding the parameters. Well, thanks to clinical evidence and national cost data, we can estimate the budget impact at the hospital level of adopting CytoSorb for different countries. Here we have the example of Germany with very similar results to what Professor Geidel presented earlier. And thanks to the probabilistic analysis, we can express how confident we are of being cost saving. So we think 72% of the patients will be cost saving. And we have similar analysis for Poland. So you can see that we are quite confident that more than half of the patients treated with CytoSorb will at least be cost saving. Further analysis, I will just go very briefly over this. There is also a publication that we have performed an analysis taking into account long-term consequences of removal of CytoSorb. This was again based on the data from the original publication, and the long-term consequences were based in the reduction of blood transfusions. That means the long-term consequences of the blood transfusions that were avoided. And the results were again cost saving. Therefore, it is a cost saving intervention for patients who require emergent cardiac surgery. So as a summary, we can say that we are quite confident to say that CytoSorb therapy in emergency open heart surgery patients receiving Ticagrelor is a safe treatment, that it may improve important endpoints such as length of stay, use of blood products, reinterventions, surgery time, that these are important cost drivers at the hospital level, and therefore CytoSorb is very likely to be cost saving at the hospital level. And that's it. Do you have any questions?
Raise his hand, so I will allow you to talk. HSBD, it's your stage at the moment.
Yeah, my question was how long a pump run can the CytoSorb stay? I mean, if it's a very long pump run, for example, it's a valve or a double valve or a complicated procedure, what is the longest that you have used the CytoSorb on pump?
I mean, in general, we can say that the use of CytoSorb is CE marked by 24 hours.
Okay.
Right? So that means hopefully you will not have 24 hours cardiac surgeries.
Right.
Yeah. Okay, but it's there's no problem with using CytoSorb for up to 24 hours.
Okay. Now, can you use it if you're not going on pump? Can you use it like, say, a dialysis machine if you're doing a beating heart surgery?
Yes, we can. You can use any kind of renal replacement therapy systems which are on the market. You can use also ECMO systems which are on the market. Okay.
So it doesn't have to be a pump case. It could be a non-pump case also.
Yes, you need a collection. You need a blood pump, blood circulation, of course. Extracorporeal blood circulation.
Naturally.
There's another question. Sorry to raise up. Have seen CytoSorb used in treating COVID-19 patients? If yes, what are the results? I mean, maybe I can ask Stefan if he's available. I don't know, Dr. Geidel, is Stefan Baudes close to you?
Yes, he is.
Okay, maybe Stefan can give us a small overview about CytoSorb in COVID-19 patients.
Yes, we had a wonderful webinar last week. It's also available on YouTube. So a lot of questions regarding this topic are answered in this webinar, but of course, it's a current problem, and we saw a lot of nice effects of CytoSorb in these patients, but we have to investigate more this kind of disease, of course, to know better when to start, when to stop, the right dosing, and so on. So there are still some open questions, but the good message is, and this is what several people reported so far, it's safe and effective in removing cytokines, and this has, of course, other clinical benefits for these patients. Yeah? So this is what we can already summarize, but as said before, we will do more trials with these patients, and there's one prospective observational trial running, and there's also one randomized controlled trial running related with COVID-19 patients in an ECMO situation. So yeah, we do a lot to learn more about these patients, and I think the story has just begun, so to say. Yeah. And we know that there is no standard of care so far available for these patients, and so we learn every day a little bit more, one can say.
I think we are done. Thank you very much for your participation. Thank you very much, Dr. Geidel. Thank you very much, Daniel, for having this webinar. I think very interesting, and just my recommendation, or not recommendation, my hint, try to find or talk with your local representatives from CytoSorb. Much more webinars will come up, and we can use the time to spread the knowledge about CytoSorb. I think it's very beneficial for the patients and also for you as surgeons. Thank you very much. And with this, I would like to end the meeting. And again, thank you very much. Have a nice evening or morning or wherever you are from at the moment. Stay safe.